Hi, I'm Dr. Margreet Wibbeling, midwife specialist and your host of the Birth and Baby show, brought to you by Sister Lillian Center and Sensitive Midwifery. We empower moms and midwives to have the best birthing and parenting experience through natural, physiological and intuitive care, resulting in birth and baby advice you can trust.
This episode is brought to you by Simplex, who has been one of the market leaders for more than 2 decades, providing quality products at an affordable price, trusted by moms and midwives alike. Visit simplex.co.za for a healthier way of life.
Hi everyone, I am here literally in a studio, a Pilates studio, and I'm very excited about this episode because I've got a Pilates instructor with me here, and we are going to be talking everything about exercise, movement and Pilates for mommies to be, and also for birth and how you can prepare for birth. So this is going to be really great, and I want to welcome Lisa. Hi Lisa, welcome. Here.
Hi, thank you.
How are you?
Good, thanks. And you?
Also good, thanks. Very excited that you said yes to collaborate with us here.
I'm very excited. Yeah, this is my passion, babies and exercise, my 2 favorite things.
Right, and you are a mother too, more than anything else.
Yes,
okay?
yeah.
So maybe share a little bit about yourself.
So I am a mom of 2 boys. I started teaching Pilates, I was qualified in 2014. So I've been teaching for 9 years now. And during that time, I did yoga qualifications, personal training qualifications, and then I found prenatal and postnatal workshops, which I really loved. And yeah, they've been absolutely great. So I've now led a couple of moms. We do it sort of in batches, and at the moment I'm now sort of doing mainly the online stuff, but yeah, all in terms of Pilates.
Wonderful. And I did a few classes with her and she's really good.
Thank you.
She knows what she's doing. So Lisa, we know that everyone knows, I think, that movement and exercise is really so essential for our well-being in general. How does that play out when we want to be pregnant or when we are pregnant?
So definitely before pregnancy, I think it's a good time to start looking, if you are trying, it's a good time to start working on kind of strengthening up, mainly because that being pregnant and giving birth and then having a baby afterwards can be fairly physically taxing. Sometimes things surprise you that you weren't aware was going to happen, before you got pregnant. So it's really good to start strengthening sort of mainly core. We talk about core, but it's kind of like abdominals, lower back, glutes, that kind of stuff to support the body when you are going to be carrying extra weight in some way, shape or form. But the baby, as an extra weight. And then during pregnancy, it's really good just to keep mainly, I like to think of it more as an internal thing, like circulation going, fluid, that the body's moving, you don't get that sort of fluid retention, lots of swelling, all of that kind of stuff. It can also do quite a lot of wonders for mental health, sort of if people are feeling tired, depressed, all of those things are kind of like, the more lethargic you are, mentally, the same thing happens to the body and vice versa. If you kind of always just really sedentary, it can kind of take a bit of a toll on the mind. And I find that with hormones sort of surging when you are pregnant, that mental health can be a bit of a challenge
for sure
anyway. So yeah, keeping moving and keeping active can actually really help that.
Yes.
Yeah.
So that applies for everyone in life.
Yeah.
So ideally we would love women to already be working on exercise.
Everybody
and some
should be
sort
doing
of fitness.
Pilates.
Yeah, everyone should be doing Pilates.
But yeah, ideally you should be doing it before, but even if you haven't, it's okay to start specifically Pilates, not all exercises. You can't kind of jump into any exercise. The day you find out that you're pregnant, you shouldn't just now all of a sudden want to run the comrades or something. But Pilates is one of the ones that you can actually kind of start with, as long as it's a specifically prenatal class, which I think is quite important. I've had a lot of moms who've approached me and said, can I pop into a class because I found out I was pregnant and my friend has said Pilates is good during pregnancy. And I always say to them, like, you can't just come into any class. It's not just any Pilates is good for pregnancy. You need to be doing specific movements and, more importantly, avoiding certain movements when you are pregnant.
Okay, so let's unpack that a bit. So when we come with exercise, when you are pregnant now, then say you've never done any exercises. It's not that you can't start with anything when you're pregnant. But
I've got to start slowly.
Yeah. What are the things that are so crucial with pregnancy that you need to be so careful for?
There's actually more than what people are kind of aware of superficially. You know, often people think like only once they've got a big tummy, that's when you're kind of pregnant. But internally, there's a lot changing. Like your blood volume increases by like 45%.
Yeah.
So your body's having to work a whole lot harder. Your cardiovascular system's working significantly harder. So it's not like saying, well, because I don't have a big tummy, I can just do exactly as I was doing before getting pregnant. All of these things are happening kind of underneath the surface. But also there's things like, obviously you can't lie on your tummy after a certain point. But even things like lying on your back, which seems sort of strange perhaps for new moms if you've never been pregnant before, but lying on your back is really not ideal, and not an ideal form of exercise. And a lot of exercises do require you to lie on your back. And then the other thing is just not working the abdominals, well, working the abdominals, but in a different way. So we don't want to do any kind of crunching movements and stuff like that, which can happen not just in Pilates, but in other types of exercise sort of programs and routines. And if you just go to the gym and ask somebody to help you out, you know, they might say to you, oh, this is fine while your tummy's small. But from a hormone level, your body's already producing that relaxin from quite early on, even if you don't feel it. Obviously, it, you know, builds up, but that can already start some of that abdominal separation and stuff like that. So there's quite a few things. Also, in terms of lifting weights, there are guidelines sort of across the board. There's people who believe that you can carry on as usual. There's others who say no more than 10 kilos. One of the ones that I've recently come across, which I think is a fair sort of go between the two, is that you should start decreasing your weights every trimester by between sort of 10 and 15%, which I think is a fair one. Although all moms should check with some kind of, you know, health professional.
So that would be typically for your sportswomen that has been used to doing whatever weight training, gymming, right? They need to start reducing towards the end.
Yeah, just kind of starting to relax the body a little bit, and understanding that your body's already doing quite a lot of work itself. You know, it's growing a whole nother human, and that human has only got 9 months inside of you. You've got a long time after the fact to try and get yourself into whatever condition you want to. But perhaps now is not the time to set hectic goals. You know, it's probably not the time to do those heavy lifting type things.
So if I listen to you, we're going to have to find in the balance for exercise and pregnancy. So we want people to move, even if you have not been used to it. And if you have been used to exercise, try to find
a good compromise between your own body taking strain and the baby needing space to grow and nutrients and stuff to grow.
I heard you mention the relaxin hormone. Maybe you can explain that a little bit more. Not sure if everyone knows about that hormone.
So what happens is the body starts to produce a hormone that relaxes joints, well, ligaments and muscle tissue. And that's obviously so that your uterus can expand and that the pelvis can start to sort of open and expand, ready for birth. But unfortunately, the body can't tell the hormone exactly where to go. That would be great if it was completely isolated. So what does happen is that all of the joints become slightly compromised because it's not housed in a nice sort of firm structure. It's kind of, a little bit mobile. So if you had like a knee niggle before you were pregnant, you've now added extra weight and a relaxed joint. This is the time when that knee niggle is going to potentially become something a little bit more than a niggle. And I mean, you can actually kind of injure yourself. I don't want to say injure because I don't want to deter people from exercising, but you just have to be aware of how you are moving the joints. Even things like a Zumba class, for example, is classified as preggy safe. But if you know that your knees or ankles or whatever have been problematic before, doing sort of sharp movements where you're kind of changing direction quite quickly can actually pull that knee into quite an uncomfortable position. And you might leave there with a bit of a sore knee. But obviously you can just gauge for yourself. If the joints are feeling quite strong and whatever, then carry on. But that is one of the things that happens with pregnancy that people might not be aware of, because it's not in relation to sort of a tummy. But even things like wrists, you'll see when we exercise that with preggy clients, we come on and off of the wrists quite frequently. It looks kind of very disjointed, but it's because we need to give those wrists and whatever a time to rest. The other thing that happens is our rectus abdominis, our abdominal muscles, are joined with sort of a muscle sheath or a fibrous tissue in the middle. And with that relaxin, that starts to separate as well. So if you're doing too many abdominal exercises, it can actually really sort of aggravate that stretching. So it's supposed to stretch so that we've got space for a tummy, but it shouldn't, overstretch. Unfortunately, it is sometimes just a hormonal thing. Some people, even if they're completely cautious or don't do anything, will start to get that bit of abdominal separation, but it can be avoided by not sort of overdoing abdominal work.
Yes, it makes complete sense.
Yeah.
Yeah, great. So in general, outside of Pilates, what are good exercises that women can do?
Definitely walking. I always say walking is like the number one. I mean, as long as it's comfortable for you, but walking is really great. Also, just to kind of get the cardiovascular system, so heart and lungs, prepared for the fact that you're going to have to go into labor.
Yeah.
And labor's hard, which is why it's called labor. But yeah, so kind of just keep walking. And if you are a jogger or whatever, I think continue with a light jog as long as it's not uncomfortable is also perfectly fine. Yoga is also great. Although again, with the relaxin, we don't want to overstretch the joints, because you might feel like, I'm so much more flexible today than I was before I fell pregnant, and that's very much the case. But you don't want to overstretch a joint that shouldn't be in a certain position. But otherwise, yoga is fantastic. Pilates is great, and any sort of light aerobic exercise, as long as the trainer or whatever has some idea of pregnancy classes, carrying on with like I say, Zumba is classified as sort of pregnancy safe, but just always being aware of the changes that are happening in your body, not just sort of carrying on at your leisure.
Yes, great.
Yeah.
So those are really great pointers to take on and to remember. But we do want you to move, and whatever way, just keep moving, and just a walk around the block is fantastic.
Yeah.
And if you can find a Pilates instructor or a yoga instructor that has some experience with pregnant women, that would be ideal.
Yeah.
Just to get that nuance difference. Yes.
Yeah, just to start to strengthen and tone.
Yes.
Muscle endurance.
Yeah, great. So then let's move on to birth preparation, because I strongly believe that exercise can really help you for a good birth experience. What is your experience with that?
My experience is that I pushed myself into labor. Well, who knows, but I was doing squats, plie squats, which is a wide stance, the morning of the night that I had my first child. So yeah, I definitely think that was helping getting everything going. Yeah, it's just, creating that movement, which is just helping the whole internal process carry on. You can also do things, specifically it's a yoga stretch, but we included in our prenatal Pilates. In yoga, it's called sort of a goddess squat. In Pilates, they just call it a deep squat, which is very low to the ground. And it's actually one of the sort of labor position. Sorry, I don't know everything about labor, but it's like one of the sort of labor positions that is also sort of an option. And it's great to get into those sort of hip opening type of movements. But that should only be really focused on after sort of, 35 weeks or whatever, because we don't want to
induce labor.
So, but it definitely can help. It can help to get things sort of moving and going. Like I say, I made sure my baby came on the day it did, because I was doing a whole lot of squats.
Wow.
Yeah.
We might ask you to demonstrate those.
That's fine.
Right. So for birth preparation, birth is all about movements, getting the baby moving freely through the birthing channel and so forth. And I can imagine strengthening certain muscles is important.
It is really important. It also helps to strengthen the pelvic floor. But in Pilates, in prenatal Pilates, it's a bit of a fine line, because we don't want that pelvic floor to be too tight when we're trying to actually give birth. But we also, after birth, want to make sure that, it's in some sort of condition. So we do a lot of pelvic floor, but in a specific way. It's not just like, it's not a thumb sucked way. We do it kind of in a specific way in the Pilates. And the other thing that we do is we start to work our transverse abdominis, which is sort of like a big corset. I always describe it as a big corset around a woman's body, which helps support the organs and the baby and stuff when we are still pregnant. But also just having that muscular strength, I found personally with contractions. I have no idea if this is scientific proof, but I found personally having almost stronger abdominal muscles assisted me being able to deliver. I have no idea if it was helping, but it really felt like it was helping. The fact that I had that sort of strength and support around my middle. Yeah.
Yes. Yeah. Makes sense.
Yeah.
Because it is all body work.
Yeah.
Yeah, a lot of body work. Great. So we are going to be blessed by her actual demonstrating that in our course. So we all want you to look at a course.
Yes.
So if this is all going but over your head, all the technical stuff, just get to someone that knows what she's talking about, and then you just do the classes. So we are really going to do that for you, prep that for you. Then I want to talk about life after birth, because I think as women, we always just are so concerned about our bodies when you've given birth, and it's quite a real thing. How did you find that?
So for me personally, in fact, when I gave birth to my first son, I didn't realize how big my tummy was going to stay for so long.
Right.
It was actually it was quite a shock. But aside from that, you do want to kind of jump back into it because you want to look a certain way or feel a certain way at least. And I found that when I went back to work, which is Pilates, I really struggled with my strength more than I was anticipating. So I feel like moms need to be really easy on themselves and understand like what you've just been through, what the body's just been through. Growing, housing, and then giving birth to a baby is certainly not easy on the body, and so you kind of have to give yourself a little bit of a break, basically. I also have found that moms want to jump into classes really early on. First of all, there's certain, things that need to go back to normal, especially if you've had any kind of tears or stitching or whatever. So it's not great to just jump back into a class. But on the other hand, it's the same thing. We've still got that relaxant in the body. You've still got those abdominals that have just been sort of really separated. You don't want to start to do a whole lot of crunches and stuff like that. But sort of general guidelines that I've sort of seen and been made aware of are sort of like you can start walking, even from as early as 2 days if you've given natural birth, and as long as everything is, fine and well. Cesareans are a little bit different, obviously, because you have a scar, sort of open tissue, so that's a little bit different. But I generally say to people that you have to wait at least for the 6-week checkup before coming to an actual class with me. And sometimes with cesarean moms, I even take a little bit longer. And we do start with a specific postnatal class. It's not like you just jump back into a class because, like I say, your body is still undergoing some of those changes that has happened before. Even though the baby's now out, it doesn't mean that the body's just gone straight back to square one. So I do think that working correctly postnatally is quite important as well. But, you can start walking, even things like swimming, as long as, the stitching in terms of cesarean is a little bit different. So you'd have to get sort of advice from somebody who's a little bit more clued up on that than me. But, certainly walking, swimming, even cycling, those are things that you can get back into fairly quickly. But leaving the sort of torso strength work to perhaps just wait until you are a little bit stronger and that the body's hormone levels have kind of regulated a little bit. But I also feel like from my own personal experience, it was hard work just having a baby, having a newborn and breastfeeding and sort of doing all these things. And even if you're not breastfeeding, going backwards and forwards to heat up bottles and all of that, it's taxing. So I feel like don't rush into something. Like you've got time. It's not like you have to be back in your first ever pair of jeans that you've ever worn, straight after birth. So give yourself time and give your baby and you time instead of wanting to, jump straight back into it. But there are certainly benefits in terms of that healing of the muscle separation. Doing the correct forms of exercises can actually sort of speed up that healing process. There's definitely benefits, and to keep moving, same thing, circulation, fluid retention, all of that kind of stuff. But just go easy on yourself, I think.
Great. And I'm sure someone is going to want to ask this question, so I will ask it for them. What about if you're breastfeeding and exercising?
So you just have to be aware of calorie intake, because breastfeeding takes a lot of calories. Well, to produce the milk is taking a lot of calories, and then obviously to exercise is using a lot of calories. So you don't want to over-exercise and then not have enough, basically, energy within the body to create enough milk supply. So definitely make sure that you're eating enough of the right stuff, hopefully, but eating enough to create that milk supply while you are exercising. Also, finding the right bra to exercise is quite important, because it can become quite uncomfortable, and especially if you're away from your baby to exercise, it can sometimes become quite uncomfortable. So I think finding the right bra, but otherwise, as long as you are eating enough. I heard, and I have no idea if it's the truth, I personally don't think it is, but perhaps you can enlighten me, that I've once heard that somebody said to me, I mustn't exercise because the lactic acid gets into the breast milk and the children don't like it. Both of my kids were breastfed until like 15 months, and I exercised every day with them, and obviously they got the taste of lactic acid or something and they were fine with it.
They were
But
fine.
so I don't think that that's a fact, but yeah. My kids were absolutely fine being breastfed. Like
Yes.
I say, it can get sometimes uncomfortable, but that you just kind of have to manage and just try and,
Yes.
I guess, feed before you exercise and just make sure that, it's not
Yeah.
at the end of or when the baby's about to eat. You don't want to then start
feed,
lying on your
definitely
tummy.
feed before.
Yeah.
Yes,
Yeah.
and then on the other side of the coin is that breastfeeding really helps you to get your body back.
Yes. Yeah.
Especially if you do it for more than 6 months, not
Yeah.
if it's only for 6 weeks, but longer than that. So that could also be your exercise.
Absolutely. And breastfeeding.
Yes.
My sister actually, when she was pregnant, she said that she loved the breastfeeding part of it because she was like, she could eat whatever she wanted and she never gained weight. So yeah, breastfeeding does help. Although I have had friends who say that it hasn't sort of helped as much as they like, but it certainly makes a difference. Yeah.
If you're exclusive breastfeeding.
Yeah. Well,
it depends how people breastfeed also, I think. Yeah.
But it certainly helped for me.
It takes a lot out of your body.
Yeah.
So be patient with yourself also in that regard of wanting to do a lot of exercise. It's a lot of hard work.
Yeah.
Yeah.
Yeah. In fact, you need more extra calories with breastfeeding than you do with pregnancy itself. You know, people think that you're growing this baby, it's going to take so many extra calories. But in fact, the breastfeeding requires more additional calories in an average day than the actual growing of the baby. So it's a lot of work for the body. So on that note, also just hydration, making sure that especially if you are exercising, that you're drinking enough water, because that's obviously what's going to help with milk production. And being dehydrated obviously has other side effects, basically.
For sure. Yeah, that's the bottom line always of exercise. Yeah. And make sure that you replenish it with electrolytes and minerals. And yeah. Great. Anything else that you would love to tell the listeners?
Just that, if you can find a class or even a walking group or a swimming group or something, I have found that having sort of led ladies through the pregnancy, it's been so amazing that people who, like some of them are pregnant for the first time, some with their second child. And then the first time mom asks the second child mom what to expect. And, it was just such the little workshops that I've done with moms have been so amazing. Moms can talk about things that maybe you wouldn't talk to your friends about who've never had babies, or, you might be sort of embarrassed, but if somebody else brings it up in a class, then it's just such a nice way to discuss. And I think moving your bodies in an environment with other people kind of lends itself to you opening up about what is going on with your body. You say, oh, this is uncomfortable, that's not uncomfortable. So it's really nice. And I actually have moms of mine who've done courses with me, at the same time and whatever, and they've gone on to be friends and their kids are friends. And, it's just nice to have that sort of community. So yeah, if you can get together with somebody, even if it's just one other person, and even if you're just doing something in your home, but just to kind of create a bit of a mom community, it's really nice.
I like that a lot. Yeah. It's all about community.
Yeah.
Don't be on your own in this journey.
Yeah.
And also to have a training buddy helps a lot.
Yeah.
That's also
keep you motivated.
Yes. Wonderful. Thank you so much, Lisa. That was insightful.
Thank you for having me.
Yes. I hope you enjoy that. And remember, we are recording a course and go check it out, and that you can actually get going and invite your pregnant friend, and go do these classes.
Yeah.
It's going to be good.
Yeah.
Yeah. So that was us for today. See you next time. Thank you so much for joining us today. If you enjoyed this video, please share this with a friend who will benefit from this. And remember to subscribe and hit the bell icon so that you can be notified whenever we release new videos like this on our channel. We'd love to stay in touch and keep you updated with all our latest content and resources to equip and empower you. So if you're a midwife or any type of birth and baby worker, go to sensitivemidwifery.co.za/free gift. If you're a mom, visit sisterlillian.co.za/free gift for more training and resources. That way we can keep you up to date when we release new episodes like this, plus a few other bonuses. You can also find the links I just mentioned in the show notes. Remember, you're making a big difference because you are shaping the future of humankind. Thanks for watching, and I look forward to journeying with you.